Thank you so much for your participation. This is first of the series, the meeting with professors. As we move to fully online program, the interactions between the faculty and the students more important than before. That's obvious. And then we kind of, brainstormed how to improve the interaction. And so this is one of the efforts. So I arranged 7 or 8, similar sessions based on the concentration, and then one for academic libraries. So not only this session, depending on your other interest, please consider to participate in the future sessions. And we have great faculty with expertise in each area. So I'm very proud of our faculty and our students as the Dean of the School. By the way, I'm Usop Jong, Dean of the School, if you don't know me yet. Again, I'm very pleased to offer this series. So, and we have Dr. Ma, Dr. Vardell, and Brenda here, all teaching informatics / health information professional concentration areas. Who will be the first?
I think Emily and Brandon, your slide, I think is perfect for the introduction.
Oh, great. Yeah, hi everyone. We're so excited that you're here. All 3 of us are really passionate about health sciences librarianship, and it just brings us so much joy to see an growing interest in this area among our students. So we're excited to continue to foster that. As Jenny was saying, I've got some slides that I have that kind of walk through my background and Brenda's background as health sciences librarians, just some of the different projects that we've worked on to give you an idea of kind of our career trajectories, what brought us to health sciences librarianship, and then some of the different projects that we've been involved in, just to kind of give you an idea, because you may not know all the different kinds of things medical librarians can do. So we're hopeful by sharing some of this, it'll give you an idea and give you an idea of some of the questions that you could ask us, but we really want this to be conversational. So if you have any questions or you want us to talk more about something that we kind of mentioned, because we'll just go kind of briefly through everything just to give you a quick overview. But if there's something that catches your attention or that you want us to elaborate on, let me know. We will stop. Like I said, we want it to be conversational. So just to give you a little bit of background about where we've come from, and you'll see in the slides kind of a different varieties of ways to get into health sciences librarianship. So this is a little bit about me. I do have more of a science background than you'll see that Brenda does. So kind of depending on what brought you to health sciences librarianship, you might see yourself a little bit in the different trajectories. So I got a bachelor's degree in biochemistry and German, and then I got my master's online. And then we'll talk a little bit about this. I did the National Library of Medicine Associate Fellowship, which I highly recommend if you're interested in medical librarianship. And then I was the Director for Reference and Education at the University of Miami Medical Library. Then I got my PhD, and now I'm here. So you can see a little bit about kind of what brought me to health sciences librarianship, what some of my experiences are, and kind of where I've continued to grow in this area. So this is a little bit about Brenda. Brenda is an adjunct professor here with us at SLIM. She teaches a lot of the health classes. And so this is a little bit of an overview about where, what's brought her to health sciences librarianship. So Brenda, I'll just kind of go through the slide if you want to talk about your background.
I'm sure, as you can see, I got my bachelor's in finance, so nothing in medicine or health sciences. And I grew up in California, so I'm actually a Cali girl. I grew up in the San Fernando Valley, if you're familiar with that area. And so I did that, and I actually work in an academic library doing my undergraduate degree, and I thought I was going to go into business. So that was my background. I was going to go into banking, and all of that. And the U.S. Treasury, I actually worked for them for a year, but I just didn't enjoy what I was doing there. And I went back to my mentor. I call her my mentor because she was my boss at the undergraduate library where I worked. And we stayed in touch after I graduated from college. And I said, I need to change my careers. And she basically said, why don't you think about librarianship? And I thought, oh gosh, I never thought about that. I should give it a try. And I tell people, you know, it was meant to be, because that summer I talked to her, that fall I took the GRE, that December I applied to library school. I was fortunate to get the ALA Spectrum Scholarship to get into library school, and I was accepted into UCLA. So I did my my library degree at UCLA, and I interned in my last semester of library school in the health sciences library at UCLA, and I loved being a medical librarian. I liked that I helped patrons. I had family members of people of patients in the hospital, people that were doing surgeries, people that were trying to think of new procedures or new ways of treating patients. And I felt, oh my gosh, I'm part of this thing that, you know, I don't have an MD, but I'm helping them with research, and everything's new and constantly changing and doing improvements. And I definitely fell in love with medical librarianship. And I said, okay, I found my calling. I want to be a medical librarianship. And I talked to people and realized that not that many people had the background in health sciences. So don't limit yourself by thinking that, oh gosh, I need to have a background, because a lot of this is on the job training. I tell people I work with nurses and sometimes MDs, they know their topics. I know how to search. I know the databases. I know how to ask the right questions in the reference interview. They're the experts in the field. So, and I learned a little bit of the basics because you work with a lot of them, but for the most part, you don't have to be an expert in the health sciences. So there we go, Emily. I'm elaborating a little bit more, as you can see. I was fortunate to do the fellowship that Emily did at the National Library of Medicine. I definitely recommend it if that's something you want to do. From there, I moved to, it's in Bethesda, Maryland, in the NIH campus. From there, I did the second year at the University of Miami in Florida. And I started with being the finance manager because I had background in business. But then I did outreach, and you'll see that when in the next slides about what that entailed. And then I was also the head of outreach there. And then at UNC Chapel Hill, I did a lot of outreach too and work on some projects. I coordinated the graduate assistant program. And so, as you probably know, there's another library school there. So we had research assistants that like to work in our library. So I supervise them and mentor them, and they work closely with me in the library. So I did that there, and I work with the School of Public Health. And then during that time that I was working at UNC Chapel Hill, I did my MBA at North Carolina State University in the professional program. You get tuition waiver because it's another state institution. So I got the opportunity to do that and get my MBA through that program itself.
Sorry.
That's okay. And then, you know, due to professional and personal things in life, I ended up here in Kansas, and I was very fortunate to, again, find another health sciences librarianship job because I really wanted to stay in that field. And currently I'm working with the School of Nursing at the University of Kansas Medical Center here in Kansas City, Kansas. And I also work with the practicing nurses in the hospital. So I'm not only working with the faculty and the students and the researchers in the School of Nursing, I also work with the practicing nurses in the hospital. So I get to see some of the cool projects that they're doing with their units in the hospital.
So that's a little bit of overview about what we've done. And like I said, I've got some slides here that show you some of the specific projects that tell you beyond just the title of health sciences librarian. Okay, what does that actually look like? So hopefully these will give you some ideas of some of the different things that people do when they're health sciences librarians. But again, feel free to stop us, ask questions. We want it to be, you know, a conversation. So we mentioned that the National Library of Medicine, this is it. It's in Bethesda, Maryland. That's where they make PubMed. That's where they make Medline Plus. So the fellowship is a way to find out about all the different resources that NLM makes, and you get to work on projects. So it does require moving to DC. So it's not something that everybody can do, but I did not have a lot of library experience when I got my master's. So this was nice to give me the experience working in a library, and then of course, beef up the health sciences librarian background. So we mentioned we moved to the University of Miami. Here are some of the different projects that Brenda worked on. I don't know if you want to say more about what you did in Miami, or if you felt like you kind of gave an overview in the first slides.
I'm trying to remember their slides about the projects there that you're going to talk about, but
yeah,
as you can see, here we go. For the most part, one of the projects that I'm really proud of and I enjoy doing, and I think that tells you why I teach the consumer health classes. We partner with the public libraries, a lot of community organizations, and the medical school. And if you're familiar with Miami, it's a very diverse community. And so we wanted to do a lot of, we noticed that we needed to do more health literacy training and reach out to the community there. So the medical students have a program where they have health fairs in like almost 10 different locations in Southern Florida. And that's a lot of the times, the only time that a lot of these people get to see a healthcare, professional, because they don't have health insurance. And so they do a lot of free exams and all this stuff. And then they tell them, hey, you have high cholesterol. You have to watch out what you're doing with your health. And so the way that we got money for was, we basically had a booth where we had the medical librarians with a computer and a printer, and we had the public librarians there. And we basically said, hey, they told you they have high cholesterol. Let me show you where there are credible information resources such as Medline Plus, where you can find information about how to eat healthy, how to make sure that you bring down your cholesterol. And so we were saying, here's our medical librarians were showing that. But hey, if you don't have a computer at home, go to your local public library and use the resources during the events. So it was a way of basically promoting some of the services and things in their local communities, but also at the same time, we were teaching the medical students, hey, when you go and out there in practice, when you talk to your student, with your patients, sometimes it's good to tell them about credible resources where they can find information. And nowadays, a lot of that is in the electronic health record, but a way of teaching that to them to use. And so I like that because I felt like I was not just working with the medical students, but also with the public librarians and the community out there. And we were making a difference because we were educating them about health topics to make better choices for themselves, but also promoting the library and improving health literacy, and building relationships. And we got funded for that. So that's one of the things that you can do as a medical librarian if you do outreach and work with the community. And so that's one of the aspects that I enjoy doing, that because we did a lot of patient education, consumer health, but also teaching the medical students about some of these resources that they could use with their patients, but also the community organizations that they can use with the users. So it was a way of finding that collaborative effort. And I really enjoy that aspect of it. And it was a lot of fun because I got to go to different places. Like, we got to go to Key West, we got to go to Hialeah, we got to go to Fort Lauderdale, all those places in that we actually went to those communities and did this trainings and did this and worked with them. It was a lot of fun. And we got, we collected data and try to see, okay, did they know about these resources? If they didn't, are they going to use them now that they know, and all of that, and building trust with the healthcare providers too.
Yeah, this is a really meaningful project for both of us. And I think also an example of how you can do health outreach, even if you're not a medical librarian. As Brenda was saying, we did partner with the public librarians. So one of the things that we hope in the health classes that we offer at SLIM, it's not just, oh, you have to work in a health sciences library to do this kind of work. This kind of work can happen in public libraries and other library spaces too. So I don't know, is there anybody here who's especially passionate about like patient education or connecting with consumers? I think I saw Ellen. I know Ellen has experience in that. I see Alex put in the chat too. So I don't know, we'll keep going, but like I said, we'd love to hear from you all if you have questions or thoughts about this. It's pretty powerful role that librarians can play in helping improve hopefully people's health outcomes. Certainly, emphasizing the importance of evaluating information and how to find good resources and getting it into the hands of people with the right kind of information, as we know as librarians, like not medical textbooks, but stuff that's written at an easy to understand level or in multiple languages. So yeah. A couple of other things that we worked on. So as I mentioned, I was in the reference and education department. So we did a lot of search services, and we actually even had a program where we did searches for law firms. And they actually, we had a program where we charged them money to run search services for them. So because University of Miami is a private university, a little bit different. So that's something to think about when you're looking at jobs. Is it a private university? Is it a public university? And so we had this program where, like I said, we even did searches for law firms, which was kind of interesting. So if you're interested in doing a lot of different kind of heavy level searching, that's something that happens in medical libraries. A big thing is systematic review services. So if you haven't heard about that, I'd really recommend looking into that. That's kind of one of the big areas in health sciences librarianship right now, like systematic review librarianship, evidence synthesis librarians. Those are a lot of the new jobs that are coming out available in health sciences libraries. They have those kind of titles. So that's a big area. I did a lot of the library marketing. So I always try to tell my students in any class I'm teaching to kind of build up your marketing skills a little bit. So I ran the blog. I created a lot of the informational materials and things like that. And I don't have like a degree in that or anything like that, just maybe some interest in it. And I kind of tried to look out there and see what other people were doing. So that's a good skill to be able to cultivate. And one of the really cool things in the University of Miami is that we were embedded in the medical school curriculum and taught a class on evidence-based medicine that had graded assignments, which is really nice because if the students have a grade attached to paying attention to you, they are more likely to pay attention to you than if you just come in and do a one-off session. So that was a nice thing that we had at the University of Miami as well. And another thing that we did is ran a hospital library. So I have a little bit of experience in working in a hospital library. So we just did it one morning a week. We weren't there full time, but we also promoted library resources at weekly grand rounds. So it was a nice opportunity to kind of rehaul a space and think about embedded services. Again, we in hospitals, depending on the hospital library, we did a little more hand holding than you might do in other libraries. Like in other libraries, you say, let me show you how to do the search and how to evaluate the resources. And sometimes in hospitals, it's like, let me just find the article for you instead of showing you how to do it because it's, you know, point of care, they need it now kind of stuff. So it's interesting to see the kind of different approaches to providing library services depending on the kind of library that you're in and the kind of, you know, people that you're assisting. So that was an interesting experience. I will say there are still lots of hospital. We have in Kansas City, Children's Mercy Hospital has embedded hospital librarians, but there are also some hospitals that have closed their libraries. So it is tied to magnet accreditation. If you've heard about that with hospitals, they have to prove that they have some kind of library services. So that's a little bit of motivation to keep the library going, but just putting it out there, medical librarianship tends to be a really great field, better compensated than other libraries, other kind of librarianship fields. Pretty good job security, but hospital libraries have gone through some rocky patches. I will say that it seems better now, and they've done a lot of work on like value studies showing what libraries can add to a hospital, saving them money, all that kind of stuff. But I'm just kind of throwing that out there. I don't know if anybody has an experience in hospital libraries or was interested in that kind of area of librarianship, but throw that out there as something to consider. And then, as we were mentioning, we went to North Carolina. And Brenda, I don't know if you want to talk more about things that you worked at the Health Sciences Library in North Carolina.
Yeah, as you can see, I actually started with being the liaison to the Institute on Aging. Sorry about my puppy down there, you can hear. And so they actually had a small library that I also managed, and the researchers needed help. I was there to provide services. And I definitely worked really closely with the School of Public Health, and we tended to have office hours in their lobby. So as you can see, there's me with one of my colleagues, where we were like, hey, you know what, they can come to the library, but usually during their lunch break, they might have quick questions that I can help them with. And so again, we would, what do? You're trying to promote the library, you do outreach. We would just go once a week from 12 to 1 when everybody was on break, and had a table and had quick questions about EndNote, or trying to figure out, you know, I had issues accessing something, can you help me quickly? So it was a way to be in there with them. So I really enjoyed doing that. And, you know, like I mentioned, I'm really into outreach and getting outreach awards. One of the projects that we worked there was collaborating with community colleges. We worked there with 2 community colleges and the librarians there, because they, you know, had limited resources, and we were trying to see, can we create something for them that they can use with their nursing students and in learning how to search some of the databases they had. And so we got money to create some tutorials on searching and the PICO question. So I enjoy doing that. Again, as you can see, you can find different people that you can partner with and collaborate, and there's funding opportunities, which we can tell you about later on if you have any questions about that. But it was a great thing to do. In North Carolina, they have a really great program where they do a lot of outreach to other libraries out there in the state. And so I actually had the opportunity to do training in different public libraries on consumer health resources and free resources that are created by the National Library of Medicine. So I got a chance to travel around the state and had trainings in the public libraries and telling them about the resources that they can use. Because as you probably know, some public libraries tend to get consumer health questions. And so it was great for them to know about the resources and information available for them that a lot of medical librarians know about. So that was an opportunity to, again, go and do the training, which I really enjoyed doing that. And you get to network and meet people that way. Yeah. Any questions about that or anything like that? The next slide is also something that as you probably know, as a medical librarian, we tend to do a lot of information literacy classes. So I did a lot of information classes on citation managers, such as EndNote and RefWorks, because that's what we had access to in Chapel Hill. A lot of the times, a lot of the classes at the beginning of the semester, that you do a lot of sessions for the different classes, and you go and tell them about the resources available in the library. And sometimes they have a specific assignment that they're working on. So if you work closely and you're lucky to work closely with the faculty, you get to know what assignments those are, and then tell students how to work and do the assignment and do the searches. Because the UNC Chapel Hill, it's in the same campus as the undergraduate and the medical campus is in the same location. I enjoy the opportunity of working with the other academic librarians. Because we had the health sciences library and we had the regular academic library, we had the undergraduate library. I think there was a music library. And so it was a way of all of us collaborating and learning from each other. And so there was something called the research hub, where we were trying to see what were the special services that each library provides. Well, let's try to create this research hub where we can promote each other's services. And some of that was data visualization, data management, also, systematic reviews, which Emily mentioned earlier. And you got a chance to collaborate with the faculty and doing that and know about the services that you provided. And of course, when you provide your services, you were telling students, hey, you can come in and meet with me if you have specific questions for a specific assignment. And so I did a lot of one-on-one consultations with students and faculty if they were working on a specific project, where we just met one-on-one, and I did basically an intensive reference interview, trying to figure out what the research question is, how familiar they are with searching the databases, how familiar they are with Boolean searching, keyword searching, control vocabulary, and helping them understand how to do that and which databases to use for that. And so it was a great opportunity to do that. So as you can see, there's different things. So and you can see all of this in every day. I would be doing one or two of those things, or maybe one thing. So every day was different. And of course, you have meetings with your staff and your colleagues.
Definitely. And now we just have a couple, I think 2 slides left for what Brenda's been doing at the University of Kansas. And then we have time for questions and discussion. So get your questions ready. Yeah, Brenda, if you want to talk about your role now.
Sure. And like I said, specifically here in my role, I work with the School of Nursing. So again, I went back and did some instruction this fall when we kind of got to be back in campus during COVID. The campus, if you're not familiar with, we have satellite campuses. So we have the Kansas City, Kansas Medical Campus, and then they have a satellite campus in Salina, and they have a nursing and medicine program there. And they have also satellite campus in Wichita for the medical school. And so I tend to do sessions in person, like you see here, but a lot of the times for the people in those satellite campuses, I've been doing remote instruction too. And so I was actually already doing some remote instruction and remote consultations via Zoom for those distance students. And so we would just meet via Zoom. They set up a consultation with me, and we set up and do the reference interview via Zoom. And I enjoy doing that because I can share my screen and they can share their screens, and we can be able to see what they're doing and how to make their search strategy better. I've also, as a medical librarian, get to collaborate with the faculty. And if you're not familiar with systematic reviews, it's a very extensive project where they're researching a specific question, and you have to have this very in-depth search strategy that you can replicate in more than 2 or 3 databases. And they basically have to review all the references, all the citations, the content, they extract data, and they get synthesize all that information, and it gets published as an article, also or a poster, or even be presented in conferences. So I had the opportunity as the librarian to help them with the search strategy, replicating it and translating it to other databases. And I've been fortunate to be co-author in several scoping reviews, systematic reviews, articles that have been published. Some of them have presented in conferences and presented in posters. So I've been able to be a co-author in those projects. So it's great to be a collaborator as an equal in those projects, because I'm seen as someone that is part of the team and working together on that. And because I'm interested in health literacy and health communication and patient education, one of the classes that the undergraduate students, nursing students have in the first year is a health communication class. And so I've been fortunate enough that I teach 2 of those modules of the class where I go over the searching aspect, but I also include patient education and communication, and also teach, go more in depth into cultural diversity and cultural humility, because it's part of how they interact with patients. So I tend to been doing that, and I do some of this not just with the faculty and the students in the program, but as I mentioned earlier, I tend to also work with the current practicing nurses in the hospital. Emily mentioned something that in Miami she did, was going to some of the ground rounds. There's a monthly meeting that several unit leaders have at 8 o'clock in the morning, where they talk about what is going on with the different units, about research that they need to do. And I participate in those meetings and have done trainings, and also have consultations with the nurses that they maybe want to do something different in the unit. They want to maybe improve the time that they're dealing with the patients, or things that they want to do in the unit that they need research for it or present. So I helped to see that. They were doing something during COVID about how to keep the patients laying down or laying in their backs, and I helped do a background search on that. So it was cool to do something that, hey, they were trying to see what they could implement in the hospital early on during the pandemic. So it was kind of cool to be part of that project. So as you can see, there's different things that you can do, and that I'm doing right now in my current job. And then this is a project that I'm really proud of. Again, I'm like being involved in the community, and there's a big push of doing outreach for the Latinx community here in Kansas. And so Juntos, and I'll put a link after I finish talking about this, there's a program that they're trying to recruit more Latinx people into clinical trials and all of that. And so Mariana, who's the director of the program, reached out and said, I really want to see if there's a project that we can do to reach out to this community. And I said, I know that the National Library of Medicine tends to fund a lot of projects, especially when it comes to outreach. Let's see what we can do. And they have an idea of doing a podcast in Spanish with Spanish healthcare providers. And so it wasn't going to be translated. It was just healthcare providers that they speak Spanish being interviewed on a specific topic. And so we got funding to have those recordings, create a podcast. And me, as being the medical librarian, was providing health information resources to complement those discussions. And so when COVID happened, a lot of the early topics that they were covering was about misinformation, vaccines, social distancing, the clinical trials, because we wanted to reach out to the community in Spanish and educating them about this topic. And I was really happy to be part of that, because we had healthcare providers telling them about this and saying this is a myth, this is true, and then me providing information that supplemented that topic in Spanish. So there's a lot of podcasts. The program is still being recorded and covering other topics that are relevant. But it's been great because it's not just relevant to the people here in Kansas. We've been promoting it around the country, and we presented on it in different conferences, so they know that this is available freely, that people can especially try to promote this to their communities in the different states, because as you probably see, there's a lot of misinformation and misunderstanding about vaccines and COVID. And so we wanted to make sure we educate people to make better choices about their health. Again, this is something that as a medical librarian, I'm really proud to play a role in educating people and trying to deal with misinformation. So I'll put a link to that podcast there, because we're still recording new episodes on different topics. But that's something too, that if you think about it, it wasn't just being in the library, we're out there in the community recording something that can make a difference in people's lives. Thanks.
So that's a little overview, as I mentioned, kind of hopefully giving you a sprinkling of different things that health sciences librarians can get involved with, a little bit about our backgrounds. I know Jenny's worked in medical libraries too. I don't know if you want to add more, Jenny, about your experiences. Dr. Ma.
My experience a little bit different. My undergraduate, actually, I have an undergraduate in archives, minor in computer science in China. And I refused to go to the medical school because I grew up in medical family. Both my parents are physicians, and they're also medical university professor. The interesting things, I end up working in the same medical university. So, and my parents really pushed me to take all the medical courses. So I took 3 years biomedical courses. I ended up working in the medical library. I worked with reference, and I taught the information retrieval, MindLine, start a CD tower. In English, taught 500 graduate students every year. And before I left my job, I ended up as an executive director of 2 large medical universities. We have 7 large hospital, affiliated hospital. So I manage the training and also the budgeting, library management. When I start my MS in University of Buffalo, and I have an intern in the medical library. And for my PhD, I work with so many professors and researchers work on the health informatics. So I really got interest, exposed a lot of knowledge and practice in the health informatics, consumer health informatics, and the general health informatics and the health information systems. When I worked as a postdoc in college medicine at Florida State, actually I had more close collaboration with a lot of the health science librarian and a lot of the health providers, health science researchers. So I really oriented my research and teaching focus at health science librarianship. I called health information professional. I think I can share something. I quickly put something here, not as Emily's slide, just very general. Can you see?
Yeah. Mm-hmm.
Okay, I think my slide, I have 2 screens. How about now?
That's good, yeah.
Good. Yeah, this basically on one of my research project. I think it summed up very well, and Emily and Brendan just talk about all the health information professional role, because as Emily mentioned, not only the course work at the health science librarian, you can work in the different setting, library setting, or different information organization, even the medical school and the different the vendor, health informatic vendors. I think that's really sum up a lot of the things they're talking about. They have a different role in the clinical setting, in the instruction setting, for the patient educations, library management, and what else? Health informatics collaborations, liaison, outreach, inclusions. The major duty can be a point of need information, deliver the instruction, continue education, runs and morning report, research and the scholarly publishing, and the patient support advocacy, web presence and scholarly communications, data management. If you're really interested, you can go to my article. I have all the duties, all the things, and based on those, I propose the health information professional curriculum development model, how to focus on this and really help the entry level, the library school student get this field. I think that's part of my passion. I really believe this profession, if you're really looking for some challenge and a dynamic, fast-growing profession, I think that this really the passion is a good fit for you. For my our concentrations, I split with Emily and Brandon. I focus on the 3 tailored courses. One is the it's 33, focus on the health disparity. Is called the information resources for diverse population. I really tailored for this track concentration. You can focus on the delivered health information resources and services for the diverse publication communities. 800, I tailor also for the health informatics. You can work on your track. I gave you all the resources. It's 19 focus on the health information system. Those 3 courses really address the major health justice issues, current trends, and the innovative development of health information science. That's really give you different track, focus on the not only providing the information and the services, and you more focus on the technical for the related to the health. You will explore the data discrimination in public health or population health data set. For the health information system implication, evaluation, health terminology standards, data standards, health information systems, safety, access to state-of-art data science, AI application in the healthcare systems. I think a lot of the new things, I share something I just learned recently, is really the growing recognition and the national movement called the mobilizing computable biomedical knowledge for learning health systems. It's really an international community for academic, science, government working together, very interdisciplinary, ensure the biomedical knowledge in computable form is findable, accessible, and interoperable and reusable. I think that's very exciting areas. So the questions, how health information professionals are relevant and trained to support learning health systems initiative, and the mobilizing computable biomedical knowledge for actions called the MCBK. As you can see, the initiative by the National Library Medicine. I think that's an initiative to create a high quality, real world data ecosystem from the raw clinical data of electronic health records, really mobilizing computer biomedical knowledge for actions, focus on the processing, transforming from data to knowledge. I think that's really trend. In the past, a lot of research collect the data, right now, we just use the ready data available from the electronic health records, really improve the healthcare quality and the efficiency for patient care and diagnostics, better patient outcome, and cost saving. Utilizing those available EHR clinical data to value-added data source for clinical research. It really can improve the efficiency, reduce the cost, improve the data source quality, objectivity, or computability. I think that's the very exciting area and the research trend. And for the health information professional or health science librarian, have a lot to contribute. I think have a lot of potentials. So I will stop here and I'm happy to answer some questions. Why we're so quiet today?
This is a safe space to ask if you're not sure what it looks like to be a health sciences librarian. It sounds appealing. I'm glad you're here, because for a lot of people, just the name is a barrier. They think that they don't have the right expertise. So you've gone past the first obstacle. So
I was going to say, I know some people have asked me when I've talked about this, especially with COVID happening. We were fortunate that a lot of medical libraries went and work remotely. So a lot of us had the opportunity. A lot of my colleagues in a lot of the other medical campuses went to work remotely. I came in and worked from home, and so that was really great, because again, a lot of times we serve distance students, so we were already doing some of that already, those services remotely. And so when COVID happened, a lot of the resources that we have is electronic, and so all of the services that we provide, we do stuff in person, but a lot of that stuff has been virtually, or the resources that they use has been that way. So it felt like we didn't have to change too much of what we were doing. We just had to do some tweaking here and there. So now, for example, because it worked out well to work remotely, I know that a lot of medical librarians have the opportunity to do some type of hybrid working. So for me, for example, I'm fortunate that in the library where I work, I get to work 2 days from home and 3 days in person. So right now on Mondays and Fridays, I get to work from home, and then on Tuesdays, Wednesdays, and Thursdays, I go and work and go into my office. But it's interesting because even though I'm still in the library, a lot of the consultations that I've been doing with students and faculty has been via Zoom. So it's like if I'm working from home, but I'm in my office and I haven't interacted with any of the people in person since I went back to work in a hybrid way last fall. So I know that's something to think about. I know that other libraries, I know that a lot of public librarians had to go and open the library sooner than later. I do know that some other libraries had to do that and didn't have the opportunity to do the hybrid way, or at least work remotely. So that's something that I definitely felt like, because I was a medical librarian, we had the opportunity to do that. So that's something that I've been asked. But please feel free to ask us any questions about what we do or anything like that, because for me, it's great to see people interested in medical librarianship, because I want to make sure that, hey, this is something you can do. You don't have to have the expertise. You just have to will to learn, do different things. And I enjoy it. I feel like I make a difference in what I do. Ellen, it looks like you have your hand raised up.
Hello, thank you everyone for doing this tonight. This has been very, very informational, and it's just reaffirmed my interest. And Dr. Ma, when you were sharing about the electronic health record, I was wondering how much research is being done with patients and their access to information in the health record for helping them to guide their own kind of advocacy.
So basically, we have two kinds of the health records. We call the EHR, or the electronic health records. Is more for the clinical, for the health providers. Personal health record is more for patients. You can get some the link for the consumer health information based on your diagnosis and based on from the health providers. I think a different data source and the different data standards have two different systems. A lot of the vendor actually really very competitive market for those. And right now, I think the lot of the trending area is how to use those kind of the data. We have so much data, have different systems. You have the IPAC, you have the Cerner, you have the different data standards. How to use this data for researchers. The researcher, health science researcher, clinical researcher, you don't have to collect your own data. You just utilize the available data for research. I think that's the trends. For the personal health data, also lot of the developers actually use that data, put some diagnosis, put some the pharmaceutical research or genome research. I think that's also can be usable. But for the patient education, for the health information literacy, that's really the health science librarian can use your knowledge and skills and to develop and embed a lot of the core relevant and credible information resources, and we call the point of need, either for the clinical providers, even for the patients.
Yeah, a lot of health sciences librarians have tried to be a part, have a seat at the table when the universities are trying to figure out what electronic health record system are they going to use. A lot of them have patient education embedded in them, and some of it's better than others. So librarians are like, hey, why not embed Medline Plus? And Medline people at NLM are actually working on tools that will easily integrate into the tools. And then there are some libraries, it's not a bunch, but I believe Vanderbilt is one example that the librarians are embedded in electronic health records. And I believe it's usually the way that it works is a physician or a nurse will flag some information need within the record, and it goes into a list of librarian requests, and then the librarians come in and find the right patient information and then embed it in the electronic health record. So that doesn't happen a whole lot of places, but it is happening some places. So
I was going to mention that, Emily, somebody mentioned that, because I was going to be like, yeah, we have colleagues that they're really involved in that sense, that they basically get requests, or they're able to interact and have access to the electronic health records and provide assistance and information and resources in that manner. And I think it all depends on the role that the librarians have in the different campuses, and how they're seen, and how they've been involved from the beginning, and the type of outreach that the librarians do, and the directors in the different libraries. So that's definitely something to keep in mind about how you do that promotion, that advocacy for the library to be involved.
Right now, they use the AI, artificial intelligence. Right. And the quality is really bad. I think the librarian health science librarian have a lot of the advantage on this area. So how many people already take at least one health information prevention concentration course, or your plan to take one? I think Mary took several, right? Mary in my class.
Yes, I've taken a few.
Yes.
We've got two that count coming up this summer and one this fall, and probably some that Dr. Ma is teaching as well. Those are just the ones I know of. And I think I've tried to get the word out about this. I've been partnering with the Medical Library Association and the National Network of Libraries of Medicine to get our courses to count towards some of the certifications that MLA offers. So our health sciences librarianship class, which will be offered in the summer, and our consumer health information class that'll be offered in the fall. Both of those fully, if you take them, you can get the consumer health information specialization from MLA for free. It's a really great deal because normally, and I don't get anything out of this, but maybe I should be getting some kind of commission. Normally you have to pay for the CE classes that count, and then you have to apply for the specialization, and then you have to pay for the specialization, which I think is like $125 or something like that. So you have to pay a couple different places. Well, through our program, you pay the tuition for the classes, which of course goes to getting the degree. But then the National Network of Libraries of Medicine pays for that specialization cost. So it's good for 3 years. You can put it on your CV. You can even put the initials after your name if you want. But it's a really great way to show that you built some expertise in the area of consumer health information. And then they've just started another specialization in the area of disaster information. So it's called the Disaster Information Specialization. I'm teaching the disaster preparedness class this summer, and that will go to that specialization from MLA. So there's 2 different opportunities to get different specializations from MLA. Those classes count for the specializations, and they also count for the certification through SLIM. So you can kind of, a nice way to, if you're thinking about, hey, how do I get into this field? It's really important to show that you are interested and have some kind of expertise when it comes to health information. And so doing the specialization through SLIM, of course, having that concentration is one way. And then also having these specializations from MLA is another way, just to show I've taken the opportunities that were available to me to build my expertise in this area during my master's program.
And I was going to say, we keep mentioning MLA, the Medical Library Association. Right now, I know that something that I always promote is joining some of those organizations, because as a student, you get to pay a student fee, which is cheaper than once you graduate and you're a professional working out there. So I would definitely advise you to check out the Medical Library Association, which we are really involved in. I'm actually an elected MLA board member that I've been part of that for the last 2 years. It's a 3-year term. So I've been involved in some of the decision making of the organization, but they also have chapters for the different places. So I noticed that a lot of you are from different states. I would recommend checking out the different chapters, because that's another way to get involved and network with librarians. And they also have mentor-mentee programs where you can get to be paired up with someone that can tell you more about what they do. If you're interested more in clinical librarianship or more behind the scenes, because there's also the roles that you play, or special collections. I definitely think that's another way of finding out more about what is it that more other medical librarians do, or health sciences librarians for that matter, because there's people that work in veterinarian schools. I mentioned nursing. One of my colleagues here works for the health professionals, so it's occupational health, and they do data management, data visualization, scholarly communications, copyright. There's all these things that you can do as a health science librarian, and so it gets you an opportunity to network with other people, see what they do, and also sometimes as you see the job postings, I like to see what type of skills and requirements they're looking for. So you're saying, oh, am I preparing for this? Or like Emily said, maybe they want somebody that has some of those certifications or specializations. What type of things do they want me to do as you seek out internships or special projects to work with? I don't know if Emily, you wanted to talk about Utah. I know that if people wanted to do something.
Oh yes, thanks for
if
the
you want to
reminder.
mention that, because I know that we reach out to them about that.
Yeah, let me find that information. So we have been connected with the National Network of Libraries of Medicine in Utah, and there was someone who said she's looking for interns that could work in the health sciences librarianship area. So she specifically works through and there's so many acronyms, but basically it's like the educational offerings of the network. So she's looking for interns to help in lots of different areas. I'll read out some of the ones just to kind of let you know. Things like developing a content reuse strategy for videos and class materials, storyboarding new training modules, recommending a retention policy for class recordings, analyzing open-ended evaluation comments and registration data to inform new class development or scheduling. So you can see there's like a lot of different ways to get involved. So those are some general areas that she said they can also develop a project around skills that have to do with NLM resources, training, Section 508 and accessibility, curriculum mapping, instructional design, project management, metadata, website usability, and training evaluation analysis. So
is that just to mention, is that virtual too, right? Because I know
it's
that
all virtual.
It's to make sure that people, you don't have to be go
so
there
it's all
physically.
virtual. You don't have to be there in person. I think the best thing to do would be to email me and let me know, and then I'll email her and CC you just to get that connection started so that she knows, you know, where you found out about this option. But they are basically, it's the training office that handles, again, all the educational offerings. So you can see there, you know, all the way from data management to storyboard development to analysis and evaluation. Yeah, thanks so much for remembering that, Brenda. But they are looking for people, and that again is another great. I don't know that I'm guessing they can't pay you for it, but there are opportunities again to get that as a practica through SLIM if you want to have that on your transcript, or just you know, some volunteer experience through that. I again can get more information if you're interested, but I thought it should just came across our email like a week ago. So this is very, very new, and it's definitely a need that they have now. So if that's something that you're interested in, let me know and I can get you connected. Her name is Jessie Vander Volgen, and she's the associate director of the NNLM training office.
And she's also a former NNLM associate fellow too,
yeah.
so she did the program that we did. But I think the thing, as you can see, there's a lot of opportunities, a lot of resources available to you, and a lot of the times you think, you know, there's a lot of people retiring and leaving the profession too, so you never know, those opportunities are out there, especially if you're willing to potentially move, or I see that you're in different parts of the country. There's definitely, depending on the state that you are at, there could be more medical libraries or health sciences. I keep saying medical, but a lot of times we're trying to go and move into more health sciences because it's not just medical schools, but as you can see, there's other places that we work with. But there's a lot of opportunities. As you can, I enjoy what I do, and I definitely want to get more people to be more involved with medical librarianship, because we need
and
more of that.
I'll echo what Dr. Ma said in the chat too, that it doesn't even have to just be health sciences librarianship. There are people who are consumer health librarians in public libraries. There are people who work for vendors, like Dr. Ma said. You know, you can work in all kinds of capacities. We've kind of focused on health sciences librarianship because that is one of the more common ones, but there's certainly lots of opportunities in other library or information.
I was going to say, what's the GPS company in Olathe, Emily? They have
Garmin. Garmin hires,
you
there's librarians that work at Epic, which is, the big electronic health record company. There, you can work in all kinds of a variety of areas
of private sector. So definitely there's a lot of, I mean, we didn't see like medical librarians working in law firms who they do malpractice. So there's definitely a lot of places that you can go to if you want to, get that those skills.
Yes, as a dean of the school, I know the medical librarianship sounds daunting and it kind of sounds expensive, right? So I don't know how much the student, membership, the MLA, but or going conference, could the MLA conference, that's very expensive. I don't, as a normal member, even a booth there, we were kind of constantly considering, but the booth itself is $5,000. So, then pass. That's too much for a library school. But if you are interested in those activities, and then we can help a little bit. So feel free to ask. Okay, we can kind of provide a little scholarships. You have been, I'm not sure how many of you have received the scholarships in any kind of form, but we are willing to help you to kind of put your foot in that water. So feel free to ask through your professors, and also Jenny Zhang is our new advisor. So feel free to talk to your advisor, your professors, and we will, So I don't remember the exact name of the program, Emily, 2 or 3 students kind of connected to.
Yes, and
That's,
some of them are here
UNT
today. Yeah,
or-
we have the Research Training Institute. So we had our first group of Emporia students who participated, and Mary was one of them. So she's here today. She's finishing up her year and has been working on it. Basically, it's a training where you learn about research methods, and then you conduct an independent research project with supervision from faculty. And so Mary's been working on that, on mental health first aid, which has been really exciting. And then we just announced the next crop, and Ellen, who's here as well, is one of those people. So we're really excited to have that. If you're interested in that, let me know. We'll be recruiting another group to start next summer. So if you're new to SLIM, that might be good timing for you to do it next year, like 2023.
Yeah, and the point to me is we support. There's a
yes,
cost
thank you.
involved.
Yes,
So
SLIM is paying for
actually
that.
supports financially that program.
Right.
So again, feel free to ask.
Mhm.
We never know. I mean, we never know if you don't ask.
Right.
Okay.
And
So-
MLA, the conference is coming up in May. Early registration ends at the end of March, like next week. So look into that. It is a little bit expensive, but there is an online only version. And then I put in the chat, Brenda put in MLA chapter, so you can find out which one you're in. Most of you are in the Mid-Continental chapter, which I linked to, and our meetings tend to be virtual. It'll be virtual again this October. I think that the membership for a student is $5, and then to attend the conference is like free or maybe $25. So check that out in the fall.
And there's
That's a nice
scholarships
way,
too.
not too overwhelming.
And there's scholarships. I was the
Mhm.
chair of the last conference last October that we had.
Mhm.
It was virtual, and we basically, people apply for scholarships to
Mhm.
attend. And again, it's virtual. We tend to make it cheaper because I know that a lot of libraries and students need assistance that way. So definitely there's ways of attending this with help financially or scholarships. So definitely seek those out.
Mhm.
Good. Wonderful. Is there any last minute question? Okay, then, thank you so much, Emily, Jenny, and Brenda. This is wonderful. And I believe the students enjoyed this 1 hour session. Thank you very much, and have a good night.
Thank you so much, everyone, for coming. We're
Yeah, thank you,
excited
and
to be
reach
here.
out to us if you have specific questions. I'll be happy to talk to
Oh,
you
and
more.
Alex, but I'm sorry, I just saw that Alex joined us too. Alex is another one of the RTI fellows. My apologies for overlooking her. Thanks, Alex, for being here. Thank you, everyone. Feel free to reach out with questions. We're here for you. We love to hear from you. We like to help support your professional growth.
Hope to see you at the consumer health class. I'm teaching that in the fall, and I know that Emily, you're teaching the disaster one in the summer, right?
Exactly, design and the health sciences librarianship. So we do have some, and I know Dr. Ma's teaching some of the ones that she was talking about where you can customize them to focus on health as well. So make sure to look for those.
So you know how to reach us.
Yeah, I'll put my email in there as well, but you should be able to find us in Outlook.
Feel free to email us, call us, and Zoom, have a
Yeah.
Zoom talk, and we're very happy to talk with you.
Definitely.
Spread the word to your colleague, to your friends,
Mhm.
and do some promotion for this program. I think it's
Mhm.
wonderful
Mhm.
concentration, wonderful opportunity.
Mhm.